Welcome everybody, and yeah, as Kaylee said, we're happy to be here today. Of course, this is August. A lot of breastfeeding things happen in August. This has actually historically been World Breastfeeding Week, is celebrated the first week of August. And now in the United States for the past several years, we celebrate the whole month as National Breastfeeding Month. So lots of things going on this month. So I am Becky Mantle, and I'm a board certified lactation consultant and director of the Oklahoma Breastfeeding Resource Center. A little bit about my background. I actually started the lactation service at the Oklahoma Children's Hospital and ran that hospital lactation service for over 15 years. And in more recent years have been full-time faculty in the OB-GYN department. I'm going to kind of, let me move my slide here too. Whoops, maybe not yet, where I work with two of our team members who are here today, Jacqueline and Sarah, and then, but we work closely with our state health department and oversee a number of statewide projects related to improving our breastfeeding outcomes in the state. So, so our objectives for today are to, we're going to talk a little bit about the importance or the health impact of breastfeeding, look at what current laws we have that protect breastfeeding parents, what resources do we have here, both on campus and around the state, and then and the last bit kind of talk about working and pumping and a few strategies there. So, yeah, so a few disclosures. I do also serve as executive director of our nonprofit Oklahoma Mother's Milk Bank, and well, it's not exactly a paid position, that's an old slide, but and I also serve as president of the board of directors for the Human Milk Banking Association of North America, which is also a volunteer position. So that is the organization that actually oversees all of the nonprofit milk banks in the United States. So I'm honored to be serving in that role through the end of this year. And this is our team. Jacqueline, you want to introduce yourself real quick?
Yes, so hello, I'm Jacqueline Huxford. I'm also a board certified lactation consultant, and I'm the assistant director with the Oklahoma Breastfeeding Resource Center. So a big hat that I wear is managing our 24/7 breastfeeding hotline that is staffed by board certified lactation consultants around the state of Oklahoma, and it's 24/7, all holidays. Like I said, it's free. It is, you can call or you can text the hotline. And then another piece is just all the trainings. A big part of what we do is various trainings, whether they're in person or online, to health department, nurses, any profession that would work with breastfeeding families. So that is me. Thank you for being here today.
Yeah, and Amanda Parsons is our clinic provider, so she is available on campus. We have a slide about that a little bit later on, but for any kind of after hospital discharge outpatient lactation services, we do have those on campus. And then last but not least, certainly Sarah Bellotti.
Hello, my name is Sarah Bellotti, and I am the office coordinator and education coordinator here for OBRC. And what that means is I basically just try to help make sure that all of the educational offerings that we provide, whether in person or online, or rotations to residents and students that are here on campus, are all scheduled up and everybody knows where to go and what to do.
All righty. So this is our website. So just so you know that that's a resource. As I said, most of what we do is geared towards helping hospitals and healthcare providers around the state improve the care that breastfeeding families receive. So we try to have a lot of information on our website, but we do have a section here with information specifically, for families as well. So, and as I said, August is National Breastfeeding Month. So this is just one of the little logos. And this first week of August is World Breastfeeding Week, which has been celebrated, I think, now for about 30 years. So we're excited to be, meeting with y'all during a big month for us. So let's look at recommendations and health impact of breastfeeding. You know, what are the current recommendations on how long to breastfeed? Ideally for the best outcomes for mother and child. And I may at times, also recognizing that not everyone identifies as, male, female, what have you. So I may at times say mother, I may at times say parent, to make sure that we try to include all parents out there. So, but the current recommendations for the best outcomes for both parent and child are exclusive breastfeeding for 6 months. So that's breastfeeding or breast milk only, and not any other baby foods, formulas, waters, teas, and so forth. So that's all the baby needs for about the first 6 months of life. But then once they're around 6 months and able to start tolerating solids, then adding in age appropriate foods, of course in consultation with pediatric providers. And then now the American Academy of Pediatrics has just come out with a updated policy statement and aligned their recommendations with the Centers for Disease Control and the World Health Organization, and recommending continued breastfeeding for 2 years or longer as mutually desired by mother and child. Now, they've gotten some pushback on this too, because of course, as we'll say a little bit in here in providing resources for y'all, that we have a lot of challenges in trying to meet those recommendations. We don't necessarily make breastfeeding very easy here in the United States, and the AAP wasn't trying to put a guilt trip out there, but actually what they were trying to do was say that we were saying a year, but a lot of the policies that are in place out there now to try to support, say, working breastfeeding parents in the workplace ended a year, when we actually really want them breastfeeding past a year. So we need to start looking at, our insurance requirements for breast pumps and, workplace support for breastfeeding shouldn't end at a year if that mother and child are still breastfeeding. So anyway, maybe y'all know some of this, but when we look at how breastfeeding certainly impacts the child, and these are, lifelong impacts, we know that babies that are not breastfed, have an increased risk of obesity, diabetes, of course, a lot of respiratory and GI infections, even, some really serious chronic conditions such as Crohn's disease or ulcerative colitis, childhood cancer such as leukemia, and definitely an increased risk in SIDS, or sudden infant death syndrome. So, and then especially if we have a baby that's born prematurely, they really have, in addition to those, they have more specific risk, such as necrotizing enterocolitis, which is very, very serious intestinal condition that preemies are susceptible to, and they can die from it, or they can lose part of their intestine and have lifelong complications due to that. But of course, impact on their brain development. And then an eye condition called retinopathy of prematurity, or you may see it abbreviated as ROP. That's actually what caused the blindness that Stevie Wonder has, because he was born as a preterm baby and received the high levels of oxygen that can lead to that. So, and of course, increased length of stay and so forth in the NICU. Now, it also has a really important impact on the health of the mother or the lactating parent. But what the research that's been done to date, of course, is on breastfeeding women or their lifelong history. And so certainly breast cancer, and then your reproductive cancer such as ovarian and endometrial or uterine cancer have an increased risk. But we also see diabetes on here. We see heart disease on here, rheumatoid arthritis, and then we see postpartum weight retention. So if you just look at two conditions that we really struggle with here in Oklahoma, that's obesity and diabetes, and breastfeeding can really have a positive impact in reducing the risk of those for both the mother and child. So important to know that. Now, as I said earlier, we don't make it easy. to breastfeed. We have a lot of challenges, and Jacqueline can speak to this, of course, when we look at the reasons, and our hotline now is 12, 13 years old, 13 years old, I guess. So, and this is, this is why people in Oklahoma and even other states contact our hotline team, because they're having problems with their milk supply, or are they having pain with latch and things like that. Is the baby gaining enough weight? Is their milk good enough? Maybe they were prescribed a medication and they were told not to breastfeed, or they assume they shouldn't breastfeed. And then this whole pumping milk thing, and that really has to do with returning to work, and the fact that we don't have guaranteed paid maternity leave. So many mothers, we have about 25% of new mothers in the United States that are back to work within 10 to 14 days of having a baby. So really, really hard to get breastfeeding established. And what we do know from this particular study is that most mothers don't reach their own breastfeeding goals, much less those lofty medical recommendations that we listed earlier. So now just a few kind of clarifications here too. This, even short-term breastfeeding and getting some of that early milk, first milk into the baby, and some duration of exclusive breastfeeding really helps the baby's, what we call the microbiome, and kind of the bacteria and pH and a number of things in the baby's gut that really help provide protection and help prevent from infection as well. So a lot of really cool research looking at that now in the infant's gut microbiome, and we even talk about the breast microbiome and the human milk microbiome. So, but common questions that we get, can I breastfeed if I have a cold or the flu, COVID-19? Yes, yes, yes. The answer to all of those is yes. So make sure that we're clear on that. And speaking of our friend that won't go away named COVID, just to make sure that we're clear, all major medical organizations, recommend, continue breastfeeding. If you, contract COVID, test positive for COVID. We had some little hiccups with that early on when we didn't know a whole lot about it. But everybody now is, in agreement. And if you're positive at time of delivery, we still want to do all of those good practices, such as early skin to skin, rooming in, early initiation of breastfeeding. It's safe to get the COVID vaccine. It's safe to donate milk, to one of our nonprofit milk banks if you've, had the COVID vaccine as well. So when we look at some of the resources that are available that I want y'all to be aware of, and organizations that you might want to actually get involved in. So we do have a very active breastfeeding coalition for our state known as COBA, Coalition of Oklahoma Breastfeeding Advocates. And this is a nonprofit grassroots organization. It's over 20 years old now. And most all of the breastfeeding laws that have been passed in our state have been due to the advocacy work of members of this organization. But this is their website, and you can see, a number of other, they have a lot of information here about breastfeeding at work, where to get breastfeeding help, such as breastfeeding classes or outpatient lactation, what's going on, with our hospitals, and, what are, any laws and policies in our state that might impact us. So speaking of laws, this is a picture of one of the little cards that you can get free from the state health department and carry in your wallet or purse or diaper bag. And the first law that we passed, where you see the red arrow, was back in 2004. So we weren't the last state to pass one of these laws. We were kind of in the middle of the pack, so we're quite proud of that. But we had a breastfeeding in public and jury duty exemption. So mothers have the right to breastfeed. And as I think, Jacqueline, you put this on here, if you're not trespassing somewhere, then you're allowed to breastfeed. So that was one of the first really important laws that we passed. And more recently, of course, COBA advocates really worked hard to get Senate Bill 121 to protect the rights of school employees who were kind of left out of the Department of Labor regulations. So now any public school employee, especially our teachers, have the right to have paid protected break time and a private location. And school districts are, to make an effort to provide, something other than the bathroom for milk expression. prior to that, just some of our legislators had also looked at state employees and state-owned buildings. So that's another recent kind of workplace type law that was passed. So looking then also at, this is the Oklahoma State Department of Health's website, for breastfeeding information and support. So, kind of file this away too. You scroll down here, on the left, there's a huge long list of different sections of the website where you can find a lot of information, breastfeeding special needs babies, and of course, the Oklahoma breastfeeding laws and things like that. So, so a lot of good information from our health department friends. And then our Oklahoma Mother's Milk Bank. So if we were in person, I'd ask, how many of you knew that we had a milk bank before this presentation today? So that would be yeah, a question I'd love to hear. But we just moved to a new home on the Health Science Center campus. Our milk bank is an independent community nonprofit, but we serve the entire state, and actually we serve a few states that don't have milk banks. And this is, yeah, a picture as we were moving into our new location. We didn't even have the floor in here where you see some of our freezers and all, but so we've moved to a new location on campus, and more than doubled our operational, our physical space. So we've been able to really, yeah, pasteurize quite a bit more milk. All of our milk for the milk bank generally comes from healthy breastfeeding mothers who just pump extra milk on the side to donate. They go through a screening process, very similar to if you've donated blood. You get asked a lot of the same questions. They do have to have their blood drawn once during the screening process to rule out a few diseases such as HIV or hepatitis B and C. So to be extremely cautious, with the milk, since most of the milk is going to go to preterm babies in our hospitals. But this is one clip from the website, and you can click there to find out how to donate milk, go through a little online questionnaire. There's kind of a three-step process, to being approved as a donor. And then here's one of our donor moms who wanted to come by and see the milk bank and drop off her milk in person. So we're always happy to take our donors on tours. But the milk bank also has 20 some odd depots or drop-off sites around the state. So we have some in the Tulsa area, and Lawton, Clinton, soon to have one in Tahlequah, up to Bartlesville. I'm trying to think. Yeah. So we've still got areas where we're, working to have drop-off sites. So it's really easy for a mother who lives, say, in Lawton, can just drop off her milk, there locally, and then we'll send a courier at times to pick up that milk. So no one has to, try to drive all the way to Oklahoma City. And then just briefly, a special program that some of you may not be aware of is we do have a bereavement program, and about 10 to 15% of our donors are bereaved donors, and they may have lost a baby during pregnancy. And certainly anyone who loses a pregnancy after about 16 to 18 weeks is going to go through those next phases of lactation and be, ready to, feed a baby if they had, a baby that they had delivered. So, and then they may lose a baby at delivery. They may lose a baby, at home from, some other causes. So, so some of those mothers decide that they want to, pump in memory of their baby and donate milk. And it helps them feel like a mom if they didn't come home with a baby, and it helps with some of their, emotional healing as well, and a really special thing to do in memory of their baby. So, this was our memorial tree, where every mother, every baby had a plaque, and the mother could pick a butterfly to go with their baby's plaque on the wall, and then a matching butterfly to take home. So, and yeah, we're working on a new one that will be a really lovely wall mural in our new location. So then, yeah, a few resources, of course, from OBRC, the Breastfeeding Resource Center. We do have an online breastfeeding little course, if you will, specifically for families. We developed this when the pandemic hit, and we heard from our hospitals that they were having to shut down all of their support groups, all of their prenatal breastfeeding classes that they were doing. So this is about a 45 minutes, maybe an hour if you take your time with it. It's very interactive, lots of videos. Jacqueline did a lot of work to put this together, and we have this available in English and Spanish. So that's freely available on our website. The Spanish one is all in Spanish. All the videos are in Spanish as well. So a great resource to help, and any family member, could really, work through that as well. So we can help families be as prepared as possible for when they know what to expect when they go to the hospital. And then, of course, as Jacqueline said, our Oklahoma Breastfeeding Hotline, which officially was launched in early 2009, lost a decade there. And we have funding from the health department to run this, to manage and maintain our hotline. And our newer change, of course, is adding the texting. And so we're going to actually go through a little demo here. But if I were to ask y'all, and if you want to type in the chat box, what do you think is the most common reason that Oklahoma families call the hotline or text the hotline? So you can just type, A, B, C, or D. We'll just do a little poll there. And Sarah, I didn't think, we could have officially tried to do a Zoom poll. We just haven't done that one in a while.
It's kind of fun here. We're getting a lot of D's and seeing some A's. And
Seeing a lot of responses, which I kind of like.
Good.
Yeah, across the board.
Well, I would say historically, the winner usually from year to year is milk supply issues. I think more recently, Jacqueline, we've had medication issues kind of jump to the top of the list, right?
Lots of medication. They kind of, lots of medication questions.
But milk supply is some version of milk supply questions are generally, the winner from year to year. So we're going to do, if you want to, I'm going to take you through a few slides here. Or actually, Jacqueline, do you want to do this part?
Absolutely. Okay, so if everyone can pull out their cell phone and you can text in, we'll allow a minute for that, excuse me, as I speak of cell phones, putting mine on vibrate. There we go. So that's the keyword OK2BF, and then you just text 61222. And it should fire off,
Yeah.
And then it should, y'all. So the blue is
right down here.
Us, a lactation consultant. Yep. And then the green is what all of you should be seeing on your cell phone. So this, if you were a family texting into the hotline, this is what you would see. So we do offer Spanish. We can text in Spanish. We use Google Translate. We do have a Spanish hotline employee. She's bilingual. So if you happen to have a family that wants to speak to a lactation consultant in the flesh, we do have her available. And then of course we use language lines. So we have lots of resources to communicate with whatever language families need. Okay, and then, so let's assume everyone pressed 1 for English. Guess we can go to the next little slide. And then it'll give you a little screener question. So we mainly do this just to make sure if someone's texting in the middle of the night and they do have a fever or the baby won't latch or there's something a little bit more urgent going on, we want to make sure those families know that they need to call us because we are not awake in the middle of the night to hear a text message, and we're not checking the portal. So we make sure that, in this case it hit no, but if you had hit yes, it gives you the phone number to call. Please call us. This is an urgent issue. But if it says no, and then I think it was urgent was the 3-day-old baby. If it's no, there you go. We respond within about 2 to 3 hours just because it's a HIPAA compliant website. So everyone's information is safe. And we text between 7 a.m. and 7 p.m. So we can answer your questions. And there it is. We do not receive pictures, unfortunately. So we've had families want to take the picture of a medication and send it like, hey, here it is, and we won't receive them. So please don't send us pictures. We don't have those capacities. But other than that is the texting, and families really seem to enjoy that texting option. So I think it's just a little easier sometimes.
Oh yeah. Oh yeah.
And so with that, sorry to the beauty of the texting is you can keep that text on your phone, just like you would with your family and friends, how you have those and that you just don't tend to delete them, and you can continue to text back and forth once you go. So it makes it a little bit easier to continue the conversation and contact them back as you continue on your journey.
Exactly.
All right. So another resource to make sure, everyone is aware. If and some of you may not know what a baby-friendly designated hospital is, but one of the statewide projects that we oversee is called Becoming Baby Friendly in Oklahoma, and we actually help our hospitals implement the evidence-based practices to ensure, the best outcomes for infant feeding and maternal child bonding. So this is known as Baby Friendly, and we're just a little under 1 million. Of course, COVID has, put a crimp in this, but it's a pretty rigorous process for hospitals to make all of these changes. And but Baby Friendly is really about making sure that mothers have the information they need to first make an informed choice or decision about breastfeeding, and then that we are supporting them in whatever choice they make. And we're helping them in the hospital with getting breastfeeding initiated and hooking them up with resources in the community as well. Because, as many of you may know, what happens in that 2-day window of time in the hospital can have a huge impact on how long that couplet continues breastfeeding. So we want to have, the best practices happening. And in Oklahoma, you can see these are the hospitals, including OU Children's, or Oklahoma Children's, I guess. And what's our name today? Sometimes it seems like we're changing, but we now have 11 of our about 46 or 7 birthing hospitals in the state that are baby friendly designated. So you can see where they are located around the state, and know that yes, we do have Hillcrest and Claremore that are kind of in the Tulsa area. And the good news is that we now have, we are actually above the national average in the percent of babies that are born in baby-friendly designated hospitals. So we're quite proud of that and happy to be able to brag to the health department with the funding that they give us to help our hospitals make these changes, because it's not easy. And many of you may work, in the hospital setting and know exactly what I'm talking about. So when we look at, of course, resources after discharge, breastfeeding support after discharge, of course, as we mentioned here, at least on the Health Science Center campus, there's Amanda, who's part of our team, and runs a full-time lactation clinic. There are some days or times that that's one thank you to COVID, is that we were able to implement some telehealth visits. So that's been really nice. And you don't have to have delivered at Oklahoma Children's anywhere, in the area. But also, if you're in another part of the state, of course, our hotline, as we said, and other hospitals in your area, many of the hospitals, if they have IBCLCs on staff, may offer some type of outpatient care as well. If you're enrolled in the WIC program, a number of our WIC clinics have breastfeeding peer counselors, and those are excellent mother-to-mother support. We've got La Leche League leaders in various areas. You can, Google La Leche League and look up, what might be available in your area. If you maybe had a children first or some type of home visiting nurse during your pregnancy, they're going to continue, visiting and providing those home visits to you and your baby for up to 2 years. And they get, we actually provide the breastfeeding training for that staff as well. And then, as I mentioned, the COBA website, you can look there too to see what's available. The health department actually publishes a pretty lengthy lactation resource guide, so you can access that on the health department website or the COBA website, and you can look and see what's in your area as far as, are there any kind of breastfeeding support groups, or who's doing any kind of outpatient or maybe even private practice lactation that might come to my house. So that's lots of things that are available out there. All right, so in this last portion, we're going to kind of turn our focus to, pumping questions, kind of, what, when, where of pumping. And as some of you know, we do have a lot of different types of pumps, anywhere from, your manual pumps to now we've got the wearable pumps that people, my daughter's a physician on campus, and she's been back, after our two grandbabies, and of course the second baby, when the wearable pumps were getting a little more user-friendly, that she'd be sitting, in clinic supervising the residents and pumping away. So certainly has made it certainly has given new meaning to the concept of multitasking, which mothers and women are extremely good at doing. So, but depending on how much someone is needing to pump, of course, someone who's pumping around the clock, such as a NICU mother or a mother who, for whatever reason, is exclusively pumping, we're really going to want them to have either access to a hospital grade pump or, their own personal use double electric pump. And of course, full-time working parents usually benefit, from having that as well. And someone who's maybe working part-time and just pumps occasionally may be able to, may manage fine with one of the others. But getting a pump, of course, the Affordable Care Act requires health insurance companies to cover breast pumps and even breastfeeding support, such as consults. So check with your insurance company, and you should be able to get a good quality double electric pump. And most of them now are actually issuing a new pump with each baby, which is really nice as well. Some people think, oh, I'll just use the same pump for 2, 3, 4 babies. Well, pumps do wear out, and especially when you're using them a lot. And maybe through 2 babies, a pump is good, but sometimes the motor can start to wear out, and it's gradual enough that the mother doesn't realize it. I actually had one of our young neonatologists who had her 3rd baby and breastfed great with the other 2 and couldn't understand why she was struggling and her baby wasn't gaining weight. And she finally realized, well, she was using the same pump that she'd had with the other 2. As soon as she got a new pump, problem solved. Milk supply boomed, and baby started gaining weight better. So it's also, think about someone who is doing a lot of pumping, if they may need to rent, a hospital grade pump. And actually, when you think about, I just saw this in a publication recently, that the cost of formula for a year is way more than the cost of buying a pump, or even the cost of renting a hospital grade pump for an entire year. So, but as we say here on the slide as well, don't buy a used pump online. What you don't know how old it is, and you don't know how durable the motor is. And of course, in Oklahoma, if you are enrolled in the WIC program, WIC has a really robust pump program. So, but the key is that you're currently enrolled and you didn't let that lapse. So, of course, when should I pump? Of course, anytime your breasts feel full, don't let them get uncomfortably full. And, maybe times when you would normally feed the baby. Of course, most mothers, if they're working a normal, kind of daytime business hours type job, or our nurses who are working 12-hour shifts, you may need to pump 3 to 4 times, 3 times if you're working maybe a normal 8-hour shift, but, at least 4 times if you're working one of those longer shifts. So, and try to, space those out. And hopefully, as Kaylee said, they've got, a great now interactive list online, so you can see where all the lactation rooms are on the Health Science Center campus, as well as what's available, in Tulsa and Norman as well. So, and most people, figured out, storing milk, either, in the office refrigerator, or if you have, a little cooler you take to work, wherever you feel safe you know, storing your milk as well. That's a key there. So
Yeah,
so
I had a question of what to do with a pump whenever it's no longer needed by the parent.
Well, that is a great question and a very frustrating one, because it's kind of like car seats, sadly, that we now, you know, we'll certainly talk to people if they want to ask us, because sometimes if they have a pump that we don't have that we can use in some of our trainings as a demo, that we can't give it to another mother. You, excuse me, you as an individual can give a pump, you know, to a colleague, to, you know, a sister, you know, other family member, and let them know, you know, hey, I actually didn't use this one very much, or it was brand new and then I got another pump that I like better. So, you know, but we can't do that, just as, you know, we can't, you know, give car seats away anymore. So yeah,
if
go
it's
ahead.
unopened and still in the box, because like kind of like
Yeah.
she was saying, you have several children, you got a brand new one with interns, but you never opened it, so it's still in the packaging, like still sanitary or sterile, if you will. We the
can make
Oklahoma
use of
Breastfeeding Resource Center can use them, so since we're
Yes.
obviously local, but yeah,
Yes.
like everything else we've used.
That's a great point too. And if you end up, you know, you got a pump at your baby shower, and then you got one through insurance, and you know, didn't open one. And what we do too is we work with the milk bank, because if we do have a bereaved donor, we try to help them, you know, access a pump if they don't already have a pump. So that's where we would make the best use of that. So I'm just looking at our time here. I think we just have a few more slides here. And this will be available afterwards as well. But just a slide here. This is from the CDC website. I'm not going to go into great detail about you know, milk storage, but that's pretty straightforward. But just, you know that if you've been storing, you know, milk, say in the refrigerator, and it's kind of approaching one of those deadlines, then either use it or store it further. Don't discard it. So if it's been in the fridge and it's like, oh, you know, I'm not going to use it today after all, well, then go ahead and freeze it. So we are very, very careful with this precious milk. So we do everything we can to not have to discard milk, because it's so hard to come by. Yeah, just some reviews here. Some of the other, you know, laws that provide break time, and we mentioned some of these earlier, but the first one, of course, was in the Affordable, when the Affordable Care Act came out, they actually then changed the Department of Labor regulations, what they call break time for nursing mothers. But that only applied to hourly employees. So that's where some of these other laws have come from. Yeah, so I kind of mentioned that already. And so, yeah, lastly, too, if you, know of a business or employer that is breastfeeding friendly, we do have a statewide recognition program. So we want to give, you know, nice credit, and they get a certificate and everything. It's pretty easy to apply, doesn't cost anything. So definitely let them know, or let the health department know, and the health department can, you know, send them, you know, a thank you letter, just if they did something really nice. We're really supportive of you as an employee. Or if you went somewhere in a public location and you were asked to leave because you were breastfeeding, you can report that to the health department, and they will contact that establishment to let them know about the laws in our state. So so definitely make use of that as well. If you get one of those little law cards that we had at the beginning, that has all that information on it. So all right, so I will pause there and see any other questions that came up in the chat box, or anyone that has a question now.
We just had a question of who maintains the campus lactation rooms, and that's going to depend on which campus that you're on. And then it's also it's kind of a combination of I usually reach out to Kaylee if there's any issues regarding various rooms. Some people tend to reach out to us, which is fine. We all work together to try to if there is an issue with a room, to get that solved.
Yeah, and we're not directly in charge of the rooms, but we try to be the gatekeeper. If somebody identifies, you know, hey, this room hasn't been cleaned in 3 weeks, please. And because we know who to reach out to. Some of the rooms, they might be in the hospitals, you know, where, you know, we have to then contact the right hospital leadership to, you know, get that addressed. So it just depends on, what building, what campus they're on.
Yeah, if you're on the Health Science Center campus, it's a little complex with having OU Health. OU Health manages their own. And so I do have contacts for them. But then on the university side, so if you're in College of Allied Health, you're in Research Park, it's kind of dependent on the department and who kind of created that lactation room. But Live Well OU does also help keep track of that list. So if there's ever any updates, we do put our email down there for y'all to let us know. So that way we can help keep that information updated. We're not sure how the lactation rooms kind of got started or where that list actually originated, but about 2018, we kind of ran into like a little bump in the road and nobody knew where lactation rooms were, and the lists were kind of outdated and everybody had a different copy. So we just kind of, I was like, hey, can we help keep track of this? And so we've just kind of do a yearly check-in to help keep that list up to date at minimum. In case there's
I can speak to that a little bit, Kayla, because I was here, see gray hairs up here, when we opened our very first room anywhere on campus, and that was in 2004. And it was in the hospital, in the lactation center in the hospital. And actually one of our neonatologists, we were so excited, we were showing it off, and Dr. Laudiver came over in her little Belgian Frenchy accent, and said, but that's a closet. I can't sit in a closet. I'm like, Dr. Laudiver, it's a room that we got. It's just like, it's a start. And so now we have, gosh, I don't know, 30 some odd rooms on this campus. But I would ask this group, anyone here, depending on where you work, if you identify a need for a room in a building that doesn't have one or doesn't have enough or something, then absolutely let us know and we can facilitate that conversation or facilitate getting in touch with the right people to see what we can do to make that happen. So we were instrumental in working with the Stevenson Cancer Center when their new building opened, and it had not one but two official dedicated lactation rooms. So we were pretty proud of that, getting that in the architectural plans. So
and the university seems to be having some issues with the server right now. I promise our site exists and that it is usually available. I can't even get onto the parking's website right now, so there's something wrong with the server.
Yeah, it's down for me too, but I was on it like before this presentation.
Yeah, me too.
So yeah, it's just OU's doing some maintenance, I guess.
Did we have any other questions?
Any other questions? And certainly, yeah, if you think of questions afterwards or somebody else you talk to, you can always, send us an email or email Kaylee, and just, we're here. We're a resource for, both the Health Science Center and all of OU and the state. So we're here to, try to, facilitate getting, the best environment to help, more babies breastfeed longer.